I'm Andrew Dennison. I'm the medical director of brain injury rehabilitation here at Shepherd Center. I wouldn't say there was any single point I decided to become a doctor, but my father and my grandfather were both physicians in the Atlanta area, and I remember growing up going to their offices and seeing how they did things. So it had always been something on my mind as maybe what I would want to do. So my specialty is physical medicine rehabilitation. It's not as well known a specialty as many others, but it's kind of a combination of neurology and orthopedics that's particularly focused on function and having people being able to live the lives that they want to live, no matter what their impairments or disabilities are. Shepherd is really the perfect environment to practice rehabilitation medicine, particularly if you want to take care of people who are really going through the toughest things. That's what we specialize in here. We can work with patients who have the biggest problems with the best resources here at Shepherd, so you can do really meaningful work. It's really not about me, it's about the patients, and I'm here to serve the patients and the other staff members too. At least that's how I like to think of it. You want to try to make sure you're taking care of all the medical issues, of course, but another aspect of it is that we want to make sure our programming is the best that it can be. And that includes not just doing the newest things, but making sure that if you are going to start doing something new, that it really has solid evidence, and then really taking care of the fundamentals as well. I think there's a lot of positive attitudes among the staff so that people have a good time here, and I think that translates over to the families. Even though they're going through really difficult times, I think it's better to be in an environment like that. We really try to center the family within the care, so we have this concept called patient-family-centered care. And if we try to have the patients and the families determine their goals together so that we're able to direct the therapy toward their goals. And we use techniques like motivational interviewing to try to keep people's eyes on the prize of what they really want. We also are very much pride ourselves on our family training, so particularly with the more severe diagnoses, we pride ourselves on our ability to get people back into their own home and back into the community rather than being facilities. And a lot of that has to do with being able to train the families up correctly. So it's a combination of the individual family training that occurs within the therapy team, but also with all the different lectures and groups that we have and the support systems that we have, including counseling and chaplaincy. I think it's important to write down the questions that you have and know that you should feel free to ask questions of the physicians. You shouldn't be afraid. You shouldn't feel like you're bothering the physician. If you have a physician that is getting irritated with you asking questions, then that's probably a bad sign. I also train residents here in my specialty, and so they often will come in and they don't really realize how much better people can get when they're provided the right environment. It's really great to see people come back that had been here and were, say, minimally conscious when they were with me. And often they don't remember me, but their families do, and they come walking in, and I get to meet somebody that I wasn't ever able to meet fully before. But they're walking and talking and interactive, and that feels really good.